Hi, my name's Dr. Kenneth Burson. I'm a dentist here in Denver, Colorado. I've been practicing for 15 years. Advanced periodontal therapy and gum health is connected to the overall health in a lot of ways that we're starting to see play a big part in our systemic health. A number of cardiologists, family practitioners are often coming across research where we see bacteria in stroke and heart attacks being the same bacteria that we find in high populations in the mouth. And so it's become a very hot button topic, I think, across a lot of specialties that the oral mouth systemic connection is real. And it's imperative that our patients start, seeking the proper care, that any gum health issues are being addressed with the proper tools and approaches and modern technology that are available to help stop to a degree the increased rates in heart attack and stroke that we're seeing. What is advanced periodontal therapy and how does it go beyond a standard cleaning? Well, oftentimes advanced periodontal therapy refers to, something more than a basic cleaning. I think oftentimes the common term that you hear is a deep cleaning. And that simply means that the gums have become inflamed and infected and needs to be addressed with the proper tools and measures to get below the gum line to avoid that area of any plaque buildup, or when plaque is left for too long, it calcifies, and we call it in dentistry calculus. And so it's removing that because your body is actively fighting that. And as your body fights it, it makes the gum tissue more permeable to bacteria able to get in. And so here at the Denver Dentist, we use a three-prong approach, right? So we traditionally scale and ultrasonic clean the tooth surface, but we also use a diode laser that cleans the tissue to help eradicate bacteria that might be impregnated in the tissue, and an antimicrobial rinse that offers a fight for bacteria for the next 24, 48 hours as everything's healing. I've seen being able to do dentistry all over the world. Untreated gum disease can be a killer. I've seen in Indian health reservations in Arizona where teenagers were losing their teeth because the wrong bacteria at the wrong time can cause a severe infection that's not just attacking the gums, but can attack the bone. And that's in a worst case scenario. There are cases where just low latent levels of gum infection can offer large systemic issues. The number one bacteria, Strep mutans, is often found in heart attack plaques after death and strokes, and can negatively impact the overall body, especially in patients with, say, type 1 or type 2 diabetes. And so it's more than, keeping your teeth clean and keeping your breath fresh. Keeping your mouth and oral environment in a healthy bacterium state offers your whole body a better healthy state. I think oftentimes patients think pain is my indicator of need. And in gum disease or periodontal therapy, a patient that's in need, it's not often associated with pain. So we like to see gums in a healthy coral pink color that don't bleed when we brush and don't bleed when we floss. So if you notice that we're brushing and we're bleeding, or we're flossing and we're bleeding, most likely we have the onset stages of periodontal disease that need to be addressed. And so I would say bleeding is the number one identifier. In more severe cases, it starts to have a more putrid odor. And that may be hard for us to smell on our own. I know that it's a funny meme when patients try and smell their own breath, but it never really happens. And so it may be one of those things that if you're concerned about it, you need to seek an opinion of a dentist. If someone in Denver is concerned about their gum health, what they should do is give us a call. That's one that's really hard to leave to, ChatGPT and Google to just find the right answers. I always say we get what we pay for. And so sometimes getting into the Google vortex we get unvalidated responses and answers that may not be true to your situation. So it may be painting a picture worse than it actually is, or it may be giving you a sense of security that you shouldn't have because something is present and needs to be treated. So contacting a dental provider like the Denver dentist and allowing us to do a thorough evaluation is the best way to get started to understand your gum health in its entirety.